Uh, well, the presentation of communication skills in the Intro to Pharmacy Practice course is basically a conversation about key skills, how to deal with um, patients who are confused, patients who are aggressive, um, how to be empathic, how to listen, those kinds of things. So it's a basic skills in how to start a consultation and engage a patient in an interactive consultation. So that's the presentation during Intro to Pharmacy Practice. In the Communication Skills course, which will now be a Summer 1 course in the future, basically is a more advanced course. It will cover topics like medication adherence, how to deal with special populations, cultural competency, health literacy, so many of those topics, and motivational interviewing, so how to deal with more complex topics. So it's taking the foundations learned in the second year and building on it. And in both courses, there is a lab component where you interact with a standardized patient actor. Yeah, so given where it is now being implemented in the second year, my guess is that the course kind of builds upon the intro courses in the freshman year, such as intro to college, getting some exposure to what pharmacy practice is like, building on an English course and communication and how to communicate your ideas, although that's typically in writing. This could be another form of communication. And any of the social science type courses, such as if there's a sociology, psychology course that the student has taken, it builds on that. As far as going forward, clearly communication is an integral part of consultations that occur in the pharmacotherapy lab courses, in self-care, and in other courses where there's an integration of the content with practice, or learning how to apply it to practice. If students didn't have to take this course, they would not be sensitized to the key aspects of how to communicate effectively with a patient. So even if they don't use the models that are taught in class, just knowing how to communicate, how to make sure that you're showing you're listening, how to be empathic, just some core skills, knowing that these are something that patients care about and that are important to the consultation, I think you end up going forward in practice with less awareness of what's important to a patient. So clearly you become a more effective medication counselor if you're a better communicator. So having strong communication skills and a strong foundation for communication skills, you can then be more effective with physicians, patients, in communicating necessary drug therapy changes or why something's important. And so that's really important in working with teams and patients and so forth. As far as research, communication, I do pharmacy practice research involving communication, and typically any intervention that's done in pharmacy practice would have to involve communicating certain information, and clearly the best interventions are the ones that consider these core communication principles.